This is the fourth in a series of talks on important issues for patients with chronic inflammatory illnesses like mold and post-Lyme. Dr. Richie Shoemaker reviews important concepts in exercise.
One of the most frequent questions we receive is, will exercise help me? Many people will think that going to the gym for 30 minutes 3 times a week is a good idea. Plus it'll help them lose some weight. They read it in the newspaper, they heard it on TV. Actually, that kind of approach in patients with chronic inflammatory response syndrome is almost doomed to failure. Perhaps you've heard of the push-crash phenomenon where people with chronic illnesses might have a good day, they feel a little bit better than what they normally do, and they try to do a little bit more. So as they go through this extra activity, they know what's going to happen the following day. They're going to feel terrible. And it'll take up to 2 to 3 days to recover to getting back to what they were even before they had this surge of a little bit of energy. The reason for the push crash, and by the way, the CDC will call that post-exertional malaise. I call it delayed recovery from normal activity. But the reason this happens is that the blood supply to capillary beds, especially in muscles, is compromised by the inflammatory response. This capillary hypoperfusion results in reduced delivery of oxygen to muscle beds, and our mitochondria, the powerhouses of the cell that will give us 38 molecules of ATP, consider $38 worth of energy, now are starving for oxygen. There's nothing wrong with them, they're just not being fueled. And without oxygen, we will only get 2 ATP molecules from that same bit of sugar. Now that sugar is stored in a storage compound called glycogen, and every cell only has a little bit of glycogen. If the glycogen is being wasted, and 5% efficiency is wasting, what happens is the glycogen reserves are burned quickly. Since you're having interest in doing something that day, you push yourself even though you're burning up glycogen, and what happens now is your body will reach for other sources of fuel. Be nice if fat stores could be burned, but with high leptin and weight problems and lack of adiponectin, fat becomes inaccessible. What does the body do? It reaches for protein. Protein is broken down into amino acids like alanine and glutamine that can be quickly converted to sugar. So that when you had good advice from your neighbor who said, eat less and exercise more, all you did in an effort to feel better is to waste more body protein, accumulate more fat, and feel worse. We'll talk about how to use an exercise program to fix capillary hypoperfusion in our next talk.